Hi, and welcome back to another episode of PainFreeFinally.com. I'm your host, Greg Roulette, here with Houston's senior specialist, Dr. John Trowbridge. And in front of us in this episode is something that gives so many millions of America pain every single day when they get up, and that's their back, their lower back in particular.
I've got to correct you. Dozens of millions.
Dozens of millions.
Millions.
So I undershot there.
You undershot. It's one of the most common problems. And of course, it affects everything you do in your life.
It does.
Getting out of bed, rolling over in bed, you know, getting in and out of the car.
It's discomfort with everyday movements.
Everything.
Yeah.
And the problem is that we rely on drugs, we get surgery, and we still suffer.
Yeah.
And, you know, after a while, people get kind of resigned to it, desperate. They end up on, you know, hooked on the drugs and all this other stuff because they can actually move around some.
Right. They wake up in the morning, they pop the pill, and I can get through this part of the day.
Exactly.
Until they got to do it again.
Exactly. And of course, you know, we get more and more concerns about the addiction issues and stuff. I'm much more worried about the bleeding issues because when you take anti-inflammatories, you can literally create bleeding that can threaten your life just for your back. And the sad news is there's so much that can be done to help your back. And, you know, we injure it in funny ways. We slip and fall. We get sports injuries. We twist and turn, okay?
Yeah.
And you know, your back is kind of confusing back here. There's a lot of anatomy there, okay?
Right.
And you get arthritis changes, which can cause low back problems. You go, just arthritis? Oh no, that's very important when those joints hurt.
Right.
Okay? You can get disc issues, and when you crunch the discs, they get dried out and they thin down, and then you start slipping and sliding. This is a herniated disc right there. And you know, not all herniated discs need surgery. The ones that do need it right then, okay?
Yeah.
And if you don't end up in surgery for the first 20 days after an injury like that, you probably not need it. Well, then what do you do though? I mean, we don't put plastic parts and metal parts.
Yeah.
Actually, that's not true. We do put in rods and we do put in screws and we lock you together and so on. That's just not you. That's not like you were.
Yeah.
And if you need it, it's great, but what if you don't need it? And that's where the stem cells come in. We can do some incredible things, and there's not a whole lot of doctors who've actually played with this because, you know, they don't think of these kinds of injections, but it can be really neat. There's a rubber band that holds all these, like a belt, that holds all these back pieces in place so you can't overturn and overstretch.
Okay.
And if we go down and just tap those spots on the rubber bands that have been torn and stretched, your body can heal. And these stem cells direct your own body to do the healing and repair.
Right.
And you literally fix it. And when you fix it, then it's not screaming for help, so it's not having pain. I have patients who say, I'm not sure I understand this because I feel stronger, but I'm also more flexible. Right, because your muscles aren't trying to hold you still. Yeah. And you're stronger, and so everything is working right.
Wow, that's really cool.
And that's the beauty of it. You know, people complain of sciatica, and they think they've got a pinched nerve or something like that. Sciatica is most often misdiagnosed. And the reason is it's a very specific kind of nerve pinch, okay? And a lot of those actually do require surgery, but a lot of them are not really sciatica. Yes, it's pain going down the leg, but it can be from the joints and ligaments being injured and stretched, and that pain can be fixed by stem cells in a large number of cases. So people don't have to have the back surgery, don't have to be off work, don't have to lose the job, don't have to worry about a future because they can actually repair themselves, get comfortable and capable.
Yeah.
And you know, that's what I tell patients is you deserve more. You deserve the best that I choose for me, for my healing and my future.
Yeah. Now, I know there's a lot of different folks at different levels of back pain.
Right.
Right. There's the folks who are, they're really injured and they do need surgery right here, right now in this moment.
Kind of, yes.
There's also the folks who, you know, maybe they wake up, my back's a little sore and it kind of goes away and it comes back. And then there's everything and everything in between.
Exactly.
So who's the right candidate for stem cell treatments?
Desperation, okay? When you have lingering pain that just doesn't get better, and you're constantly having to worry about doing something about it, or it has started to limit your life in such a way you're thinking about limiting where you go, what you work, what you do for your future, and planning for your future. You know, people give up on their bucket list and they go, I'm not ever going to be able to do that. Those folks are ideal to talk about stem cells because if you need a repair that's not being done, it ain't ever going to get done. And so the stem cells give that prospect of actually doing that repair,
Yeah.
of actually being pain-free finally. And people need to be aware that's possible. It is real.
Yeah.
It's the real deal.
I think that's one of the big things is seeing that there's another solution. There's
It's
another
exactly.
possibility because, again, they wake up, they turn over, they take the prescription drug, they feel
Right.
better for a little bit, but they don't know any other way.
They don't have it.
That's the
That's
only
right.
way. They don't know that, hopefully the good news, you're watching this video, so you're seeing that
Exactly.
there's another way.
Right.
And the cool thing is to see if they're a great candidate or not
Right.
for this, you've set up PainFreeFinally.com and a really cool quiz on there. Only takes a few minutes. They go through it and they tell you about their situation, they answer a couple questions, and you can see if you can really help them.
Exactly, and the most important help is the best advice. And if there's something else that they need instead of what we do, we're more than happy to share that.
Exactly, because they want the result. I want to wake up
Exactly.
in the morning and go, wow, no pain.
I feel great.
I feel great, which is what they want. So if you're watching this and you're in that endless cycle of taking prescription drugs, you're in that stage where your doctor's telling you to go to surgery, there is another solution, but you need to go to PainFreeFinally.com right now. You need to take this quiz. You need to answer these questions honestly so the doc can see if stem cells is the right treatment for you so that you can wake up and say that you are pain-free finally. Thanks so much for watching this episode, and we'll see you in the next one.